Hi, my name is Sierra Jenkins. I'm gonna do wound care or dressing change for a wound. So for this procedure, most of the time it isn't sterile unless noted otherwise because wounds can be very gross. But you want to make sure that the wound doesn't have any infection, it hasn't gotten any worse. Um, you want to also measure the size of the wound every time that you do the dressing change to see if the wound has expanded. Also want to see if there's any tunneling, if it has gotten any deeper. From there, if it's packed, normally it's wet to dry. So what you want to do is get your gauze. You want to clean the site, and then get your gauze. And normally they're wet with normal saline. So you just wet the gauze that you're gonna pack it with. Wet it. Make sure that it's very dry. Wet, so that once you put the dry dressing on the outside, all the moisture is locked in. So you just want to make sure it's wet. And when you're dressing, when you do the packing, if this is the opening, you kind of just want to accordion it in there with, you have on gloves, wash your hands, but you just want to accordion it in there. Make sure you get the whole inside of the dressing pack. Then you would layer it with 4x4s. And you want to make sure you have tape. Normally we don't use this tape. You want to maybe use paper tape to keep the integrity of the patient's skin intact, because it can also rip the skin off with the tape when you constantly change the dressing. So you just tape the edges and you just make sure that the dressing is sealed. Sometimes they will put Tegaderm over a dressing, but that would be a non-wet to dry. Non-wet to dry probably have stitches or staples under it, is when you want to just clean it and put the Tegaderm over the top of it. And then but the dressing and what kind of dressing, what kind of material you will use is determined based upon the doctor's order. So you just want to make sure you have the correct order, make sure you have the correct supplies, you know what kind of dressing you're doing. Sometimes there can also be lubricated dressings where you would put Civadine or something like that on the wound and then put a 4x4 on top of it. So you just, like I said, want to look at the order and make sure that you gather all the correct supplies.